I'm thinking, what the heck?
Where's President Vanderbilt?
Here. Anyway, so I was going to say something too.
Mr. Board, how are you?
Good to see ya. Hey, how you doing, man?
Welcome back to the Greek Islands.
Oh, thanks.
Greek Islands.
Yeah.
So, just general seating? And...
Yeah, well, I think we thought we'd Pete here as a chair, then you guys can sit right next to him.
All right.
It's just the two of you, so.
How's the, yeah, this happened. Hey, what's up, Pacheco? Paul, what's going on, dude?
Well, I think we're going to, this is where I normally sit. We'll put Pete there as a chair.
There's only one other seat here.
Pete's trying to look a little old.
What's going on, man?
He's trying to look distinguished.
Just peachy.
Going for the Paul Merlin. Oh, sure.
Okay, well, he said mascara was really
Yeah.
good.
You like it?
He did, yeah. That's how it worked for me when I grew a mustache.
Yeah, she ended up sending me an email and forwarded a copy of what she sent to you.
Oh, boy.
These are hot, so you don't worry about it.
Are they?
Like ours.
Yeah.
We don't even need a little bit of it.
Want you can read gum?
Yeah. It needs to be upgraded too, right?
Made from tree resin.
Hey, thanks for the ticket and the car. I'm going to try it. I can't do it tomorrow night because I have a church dinner I'm going to myself. I'm going to try it.
The old church dinner. You know how long it takes you to get Tuesday out here? How long does it take you to get out here?
Not an hour and 10.
Yeah. Okay.
They've had it up and down. It's our, you know, it's our financial.
I didn't go last year, the year before. He was actually
No, that's financial.
That was the sight to see him in a bathing suit. Yeah, getting drunk. Yeah. That might have been 3 years ago, but it would happen. I've been there 2 years. I didn't go last year, but I went the previous 2 years.
There's a bunch of add-ons.
We had a rotary function last night. That, you know, you gave me a bunch of stuff.
Yeah, you get 14 and I got them. Yeah.
I got 14 and 11, right?
That's, I think, the last item.
Okay.
Perfect.
Yeah, they got the,
Hey, Pete. If we have a special
Yes, I did. Gee, it's not going to help in many ways for him in an election campaign. He's gonna
vote Larry in for
us, yeah.
I'm glad he's not face for the
Good morning. Thank you, everyone, for joining us for today's meeting of the San Joaquin Valley Insurance Authority. You know, when I first got here, Paul Nerlin came up and he said, you know, I kind of like this. And I said, I'm going for the Paul Nerlin look. And then he kind of cleaned up the sides. So I'm not quite there yet, Paul. I'll figure it out someday. So number one is to call this meeting to order. We will now stand for item 2, which is the Pledge of Allegiance. Please join me. Thank you. Ready? Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. All right, thank you for that. We will now move on to item number 3, which is roll call.
President Vanderpool,
Here.
Vice President Pacheco,
Here.
Director Borges,
Present.
Director Wordley,
Here.
Director Perea, Director Ennis,
Here.
Director Mendez, Director Pagian,
All right. Do we have a quorum? Yes, we do. Okay. Thank you. All right, we will now move on to our first action item, which is item number 4, a request to approve today's agenda. Anybody have any changes or modifications?
With one of the items not being capable of being voted upon, do we
We'll
delete
still,
it?
we'll still take it
We'll
up.
still take it
I
up?
think we'll
Okay.
still take it up.
Oh,
Okay.
Move for approval.
I have a motion by Director Ennis, a second by Director Borges. All those in favor, please signify by saying aye.
Aye.
All those opposed? Motion passes. We are now going to move on to the public comment period. At this time, members of the public may comment on any item within the jurisdiction of the SJVIA not appearing on today's agenda. As we saw in Fresno County last time we had this board meeting, I will take up action item public comments at the time of the action item being taken. If there are public comments related to an information item, please make those comments during the public comment period, because I will not be allowing for public comment at the time of an information item. So is there any questions, comments? At this time, we could take a public comment period. I don't have any public comment forms in front of me at this time. But if anybody would like to speak, please come to the podium. You can choose either microphone, and please state your name and address for the record. Okay. All right. Well, I have a list of public comment period here. So if you want to go ahead and come up, first I will call on Catherine Balbas.
Good morning, and thank you for listening to us today. I'm here with a group of workers. We want to talk about the health care crisis for public workers. We need to find a solution that provides workers access to quality and affordable health care. We cannot continue to allow workers to pay upwards of 1/3 of their salary for health care and struggle to provide for their families at the same time. We have a group of workers here that are going to talk to you a little bit about that. I just want to thank you for your time and encourage you to really think hard through a solution for these people. Thank you.
Thank you. Next, I have Regina Cox.
Good morning to everyone. My name is Regina Cox, and I've worked for Fresno County since 1989. And I provide quality and affordable services to patients at the Community Health Department. We offer our patients free services and some discounted services. How much is this rate increase is going to cost the county and the cities that are part of the SJVIA? We have high turnover rates, and now healthcare is going to move even further out of reach. If this passes, some employers will be paying 1/3 of their salary, their gross salary in healthcare. In Fresno County, family coverage and Blue Cross HMO will increase $3,258.45 per year. You're going to lose good employees. And when you lose good employees, you lose employees that are experienced, you lose employees that have knowledge, and the skill set goes out of the door. And then those employees have to be replaced through training, and then the trainers have to be replaced. I've spent many years training employees. I've seen employees come and go, and one of the largest complaints is that they complain about the health care benefits. It's already a revolving door in some counties. So don't worsen our turnover rates with additional costs, please. Thank you.
Thank you very much. I now have a request from Santiago Osagura, and I'm sure that's Osi Osagura because I've heard you speak at each meeting, so you're welcome to come forward.
Good morning. My name is Santiago Osagura. I'm a Fresno County employee, also vice chair of the HVAC committee in Fresno County. I was going to speak on another item, but I thought I'd just come and tell you that you find it in your heart that whatever decisions you make, you remember the people you're affecting. You're affecting the workers that provide services for the clients. And to tell you the truth, a lot of our workers are clients, which it's not a good thing. I started 26 years ago in Fresno County, And back then, the county used to pay all benefits for employee only. So please, if you can, think about all those people that you will be affecting severely. Thank you.
Thank you very much. I also have a request from Jennifer Jensen.
Good morning. My name's Jennifer Jensen. I've been a Fresno County employee for 30 years in October. And I was here, as I go see, I was going to address something else, but we are handing out a chart, and it shows that one side in Fresno County, how much an employee would be paying, the percentage for contributions towards employee only. And then on the back, how it's out of reach. Only 4% of workers in Tulare County opt for family coverage, and in Fresno County, it's only 5%. We need to find a way to get affordable health care contributions for our members, our employees. And I want to tell you a quick story about one of my co-workers. Her name is also Jennifer. She was born with a very, very rare heart condition. She's a single person. Her heart doctor, there's only one in California that treats her condition, and he requires PPOs. She had to choose a PPO, and she has the highest deductible, which I believe is $3,000 a year. That is something, she's paying $217 a pay period for that. She also has allergies. She can't afford an EpiPen. Even because of her high copay and the payment she's making now, even if her EpiPen was $20, she can't afford to get her EpiPen. A few weeks ago, she inadvertently ate something that had peanuts in it. I was there. I saw her reaction. Sorry, forget it. We had to call an ambulance for her. Her reaction was so severe, and she was in the hospital overnight, which now what she has to pay for her health care is, or health care expenses, she has more expenses. So we please need to find a way where all of our people can find health care and health care expense they can afford, so they can afford to cover their family and themselves. I remember 7 years ago, this isn't something new we've been asking for. 7 years ago,
would you please wrap it up?
at
Your
the
3
Board
minutes
of
are up.
Supervisors, we were told it's budgeting for us, our personal budgets, but it's not budgeting, and as our health care contributions increase, our budget, our family budget, our disposable income decreases. Thank you.
Thank you. All right, I have a request from Laura Hernandez to speak.
Good morning, board members. My name is Laura Hernandez. I currently work for Tulare County Child Support. I've been working with the county for the last 14 years. I'm here today because I have 5 kids, and I do have them on my current health insurance plan. I do pay almost $350 a month out of my pocket, and now there's a consideration to increase that. I did the math, and it seems to me like it's going to be over $400 out of my pocket. That difference could be substantial to my household, 5 kids. And I'm just thinking there's got to be a different way. Mind you, I have student loans, so I know a lot about budgeting and different things like that. But I do want you today to consider that there has to be a different way. There's got to be a different way to impact or make these changes. Perhaps to you, $50 or $100 increase is not a big deal. Your budgets are different than mine, and I do live on a fixed budget, just like many of the county employees. And I really want you to consider finding an alternative that's not going to impact substantially. I know you have to make changes and you have to make decisions, and I recognize that. But I really think there's got to be an alternative that's not going to impact the kids' lives, my kids' lives that are going to be impacted by this change. Trust me, it's really difficult to go to the store and say, you know what, we can't buy 2 gallons of milk this week, we can only buy 1. Or I can't buy you those tennis shoes, I can only buy you these tennis shoes. And I don't have a coupon for this, but I do have a coupon for that. And that is really difficult. And I recognize there's other agencies within the county that could probably afford free health insurance. But I really love working for the county. I really enjoy the people that I work with. And I really want you to consider that whatever decision you make, don't make it for me. Please make it for the kids, the families that do have the health insurance plan. Thank you.
Thank you. Okay, next I have Maria Nino.
Good morning, Board. My name is Maria Nino. I've worked for Tulare County Child Support for 15 years. About 10 years ago, I did get diagnosed with rheumatoid arthritis. I've still kept working, of course, after they told me that about 6 years I'd be totally disabled. So thank God, of course, that I'm still working. I'm a single mom, and as you know, not all specialists take certain insurance. So I'm not able to get just the employee one. I have to get higher one, which, of course, a lot of the specialists will take. So as of right now, this last year, I had to make a decision to either have my daughter on my insurance or not. And this year I had to take her off because I could not afford the higher price of it. I'm sorry. But now I'm looking at having to put her back on. And of course, now it's going higher. And as Laura said, a lot of our families and a lot of our workers that work there with child support with the county, they're all also doing the same thing. I do not qualify for Medi-Cal because I make too much money. But yet the money I make, majority of it goes all to the insurance. So I just kind of wanted to let you know, like I said, I've worked there for 15 years. I love my job. I love being there, and I love working with our customers and our clients. But I also need to provide for my family, and with this insurance rate that's going to be going up, it will be affecting not only my family, but a lot of the workers. And I'd hate to see so many good workers leave the county just because of the insurance, because our work is vital and our customers need us. All of Tulare County need a lot of we're doing it for the children, but we also have to see our own children. So with that, I leave you. Thank you so much.
Thank you. Next, I have a request from Colleen Biswell.
Good morning. My name is Colleen Biswell. I've been with Tulare County for almost 10 years now. I love my job. I'm an employment service worker. I help people find jobs. I help them become self-sufficient. When you go home every day and you can't be self-sufficient because you can't have your daughter on health insurance, your husband's disabled and he didn't invest enough time when he became disabled into his job so that we could have a decent health care, it's hard. My child has no health care, guys. I'm asking you please to rethink what you're doing with hiring the health insurance. We have put $2,500 max that I can do medical spending every year. It's already gone. My husband's medical, because he is disabled and has certain diseases that we have to take care of, is almost $400 out of my pocket every month. It wipes out my medical spending before the year is over. Then it becomes out of my pocket. I'm asking you, please, today to consider our health care options. I'm not the only family here. There's lots of families being affected by this. Does that mean that I'm going to leave Tulare County? No, I like my job. I like when my client comes in and says, you know what, I graduated this year. I'm going to be a teacher. Colleen, because you helped me. I was on that side of the table at one time. And my goal is to help those people that walk into my office every day and tell them, you know what, I can do this for you. Together we can do this. But if I'm so stressed out from trying to determine how to help my children and my husband meet health care, do you know there's days that I don't even want to go to the doctor because I have to pick up the health care because I feel guilty that my husband and my child cannot go to the affordable health care they need. Is that fair? I'm just asking you guys today with the biggest smile that I have on my face that I give my clients every day. Help us. We're your employees. Take care of us. I thank God every day for my job. I will not leave it. But I also need for you guys to hear what we're saying today. We really need you to hear. We need affordable health care for our children. I would go without if I could have affordable health care for my child. That she can go and put that big smile on her face because she got to go to the dentist. My medical spending is gone, guys. It's only September. Now that has to come out of somewhere. Where does it come out of? My paycheck. I'm asking you please to consider what you're doing, okay? Thank you so much. I appreciate it.
Thank you. You
You
did
have
a
a
great
great
job
day.
with your time. Thank you. John Adams is the next person I have on the list.
My name is John Adams. I'm been with Fresno County for, it'll be 14 years at the end of September. I've been before your board at the last meeting, and I did an ask for a seat on your board representing employees that hadn't seemed to gone anywhere. So I want to keep that ask open, and hopefully on a future meeting agenda that'll be brought up and discussed. I'd like to make a suggestion. Both your boards, I think, are familiar with advisory committees. I would like to make a suggestion that you have your board initiate the help from the Better Valley Health Coalition to be an advisory committee to your board. We have a lot of resources and a lot of concern to help the healthcare problems. Better Valley Health brought a consultant at their own cost, our expense, to your board at the last meeting. Had a lot of great ideas, and went through the past couple of years of your healthcare system. I've dropped off a handout to you. This shows the contributions from Fresno County and the employee. This is for an employee and spouse. It's for me. You'll notice that back in 2005, my contribution was 14% of the premium, and the county at that time, County of Fresno, paid 86%. It's continually, county capped its cost, and it's continually kept at that cap. And you'll notice that if you look down at the bottom of the ratio, the county's cost has only been 1.5 times, whereas the employee's cost has been 8.5 times. I'm here from the government to help. I plead with you to initiate our help. We want to help. We have solutions. We have recommendations to work with you. I've gotten the feeling that there is a a resistance to working with us. We want to help. I've also heard that you want solutions, you want help, but then we're pushed back. I plead with you to work with us. We have, as you can see, we have a vested interest in trying to solve the expenses of health care. See, I timed myself, sir, so I could be right on time.
You started yours on time. I started mine a little late. Good job.
So I request that you consider those four items before your board. Thank you for your time.
Thank you. All right, that is all of the written requests that I have for public comment. Are there any additional? Okay, seeing none, I'm going to close the public comment period at this time and move forward with the agenda. Item number 6 is a request to approve meeting minutes from July 14th, 2016. Hope everyone's had a chance to review them. Any issues? Questions? Okay, this is an action item. Any public comment? Okay, seeing none, Chair will entertain a motion.
Move for approval.
A motion by Director Ennis.
Second.
All in favor, please signify by saying aye.
Aye.
All those opposed?
Abstain.
One abstention, so it passes 4 votes with 1 abstention. We'll now move on to item number 7, which is a request to take up an information item regarding SJVIA Director questions, announcements, and activity reports. Anybody have any items they would like to discuss? Yeah, general comment.
Well, I think we've heard some from representatives of SEIU and others. Has that organization submitted in writing their recommendations? Because I think we've heard through multiple meetings that they do have recommendations. Have we ever gotten anything in writing from them?
I'm not. I'll look over to staff and see if there is any correspondence we've gotten.
Not formally. What we've done, and I think both counties have SEIU participating in our respective labor management groups, and so there's been discussion there, but they've not submitted something in writing per se. There has been a request, I know, the County of Fresno to have a meeting specific to wellness with that group to talk about their ideas, which we welcome, and we'll be certainly doing that, but not specifically here are recommendations per se.
Would it be okay to extend an invitation? Because I've heard this in Fresno, and obviously we're hearing it today in Tulare, that they have the ability to put in writing their recommendations, nothing stopping them from doing so.
Absolutely. I mean, we welcome that and would like to look at it, in advance of a meeting like this where we can see, what are the ideas and let's sit down and if there are misunderstandings, clear those up.
Any other comments or questions from board members? One comment that I would like to make, just because this is our chance to comment. I think it's, look, I think we're all very aware of the issues and the increasing costs that we're seeing. And this SJVIA has been an outstanding organization for our employees for many years, and we've beaten the trend of healthcare increases many years. This year, this last year, have been difficult years, and healthcare costs go up. Some of the costs we cannot control. Most of the costs we can. And if it really relies upon wellness and employees taking control of their own well-being. And look, I can't comment for anybody else on this board, but I have the insurance of the SJVIA. That's what I use. And every year my insurance seems to go up. And it's expensive. I mean, I've got 2 kids now, and I mean, I hate every time my wife says she's going to take them to the pediatrician, because that's like $90. So it gets a little frustrating for me, but I want you to know that we're not, at least I'm not up here approving increases without a vested interest in myself. And we all want to provide the best, most affordable care we can for our employees, but there are a limited number of options that we have in front of us. One of the things that both counties have done is both counties through our own health benefits consulting entities have gotten recommendations, had reviews done of the SJVIA, of our health plan offerings. And one of the things that came up in the process was a request for, or a suggestion that we look at having a financial audit done of the SJVIA. I know that we've had Fresno County's Auditor's Office doing the money management and the money handling for Tulare or for the SJVIA for a long time. And I know we have usually late annual audits done by an outside firm, but I do think it's worth exploring going out and having another outside firm come in, audit the books, look at what we're doing, look at all of the financials up and down the line, and make sure that we have a good grasp of where we do actually stand financially, given all the major changes that have been made here recently. So I think that's something we should look into. Staff, that would be at least my direction. So,
Mr. Chairman, I
sure.
want to say something. Because I will comment on it further when we get into the agenda. But one of the benefits of our program is that it is one of the more localized kind of governments. So we do, in many ways, control our own destiny. And one of the things that we will see as we look at our reports coming up later on is that what drives healthcare insurance are healthcare claims. So when we look at the claims that occurred last year, the claims exceeded the income. When that happens, rates have to go up. Now, there are other factors that have to be considered, obviously, and we will be talking about those as well. But what I'm saying to those who are here is that when we look at rate increases, they're based not upon us pulling a number out of the sky and just saying, let's charge this amount, we have to charge this amount next year. It's predicated really upon what happened last year. And when we look at what happened last year, with claims exceeding the income coming in, there's no alternative but to raise rates. And so I have to look back at us as the consumers of this product. As we increase our costs, there's no way around it. And so I just point that out, that the biggest driver for increasing our premiums is the claims. That goes back to you all and we all. We are the employees of the counties and the entities that utilize this insurance. And as we increase our claims and they exceed the premium payments that are being made, there is no alternative but to increase the premium payments. And so I just think it's an important thing to point out that whatever happens here, I appreciate the comments that were made this morning. I appreciate the Tulare County employees that came up and spoke. I was very impressed by their demeanor, by their sincerity, by the reality that they're living with, and we hear you, and we hope to help to try to address some of that. But it doesn't take away from the fact that we are going to have an increase, and that increase is going to be primarily because of the costs that were incurred last year, and as we project those into the future. That's what I wanted to say. Thanks.
Okay, and then I did have one question for Gallagher that I would ask, and that's just based on our last meeting. We had a presentation from Aetna regarding an option that they had. Has Gallagher been in communication with and cooperating with getting Aetna the information they would need to maybe submit a proposal to provide for competition? Sure, if you would. Both microphones work. You can go to either one, too. Yeah. Yeah, I mean, you were already there. That's cool, Mark, but I'm just saying, but they both work, so you can go wherever you want to go.
Mark Tucker with Gallagher. So the status update relative to exploring Aetna as an option, we are at a point where we need to have the board sign a non-disclosure agreement that will allow us to perform a claims study due to the timing and I think nature of the agenda that we're faced with today. I think it was determined, along with staff, that we continue to pursue that option, but in the interest of time, to retarget that and refocus it for a next renewal option. And so we will be continuing to pursue and vet out that option in spite of or without regard to whatever action is taken today. But I anticipate coming back before this board would be that non-disclosure agreement language that we need to sign off on. I think council has some concerns with the specific verbiage, but we do intend to move forward and continue to vet out that option.
Andres, go ahead.
Maybe my memory is a little fuzzy. Did we not delegate the authority for that non-disclosure agreement to staff? Did we discuss that prior? Or was that something that we just discussed in Fresno?
No, we did not. We did not know at the time, as part of the review process, essentially the level of detail. When Gallagher goes through this process, and they can speak to more detail, they're actually running the claims of each entity through a system to verify what the actual cost would be, not just counting on what the entity themselves would say. We did receive that agreement back from Gallagher, and there was some language that, we as staff and council agreed would not be acceptable. We could not feel comfortable recommending that to your board, and council can comment on that somewhat.
I think the director is recalling a different confidentiality agreement on a different matter.
Okay.
This is not the same one that we discussed a couple of meetings ago.
All right. Would it bear on this matter, though? Because it seems like we're losing time based on confidentiality. And do we have the authority to delegate to Paul, for example, to sign on our behalf, or the chairperson to sign on our behalf, so to expedite discussions and discovery?
In general, yes, but it's not agendized for today.
With respect to the timing and consideration, because we are focused for a next renewal potential implementation, we typically look at vendor options in the spring to be implemented the following calendar year. So from a timing standpoint, where we are today is well ahead of that curve. So yeah, the clock is ticking, but we are not at the 11th hour and 59th minute if our goal is to vet out options, not just for Aetna, but for all options. So the disclosure language, if we can find agreement to that, the jumping off point would be to look potentially not just at Aetna and Anthem, but at all carriers. And so assuming we can find middle ground on that language, that will be the next step. From a timing standpoint, again, we're well ahead of where we have been historically in looking at options in light of looking at it for a 2018 potential implementation.
I'll close with this. Chairman, maybe we put on the agenda for this type of authority to be granted to staff and or the chairperson, so that we just don't have any issue with timing and confidentiality agreement sign-off. So.
All right, thank you very much.
Thank you.
Any further questions, comments?
Chairman,
Yeah, sure.
I would just like to add that I believe we may be having a special meeting or a possible continued meeting from this one, or regular meeting in the next 10 days. We could put that item on for your board to take action, whether it's the delegation of authority or whether it's acting just on the Aetna agreement. We had looked at the calendar to bring it back no later than the October meeting, with the idea that we would be in the time frame that needed to do the discovery and the analysis that GBS Gallagher requires. But we could bring something back potentially at our very next meeting to delegate and list it and have your board take action.
And I'm good with that, Rhonda. I think that's just fine. The whole reason this is important to delegate this authority is we are trying to bring forth all options possible to maybe stave off an increase or have a lower increase or hopefully a decrease in different plan years. And having competition is really the only way we're going to do that. So I want to make sure that we can foster that as easily as possible. And typically that's through a staff sign-off or maybe a chairperson sign-off versus waiting for the next board meeting to get that authority. So yeah, I would make sure that we have that at our next meeting. All right, we're now going to move on to item number 8 on the agenda, which is a request to receive an update from the Auditor-Treasurer on cash flow projections.
Good morning, Board. Lawrence Seymour, County of Fresno, representing SJVIA Auditor-Treasurers this morning. Before you have the most significant update that I've made to my cash flow projections since we first presented this to you guys back in October of last year. And the reason being is because Gallagher has brought forth a updated draft 16-17 budget, so I thought it prudent at this time to go ahead and cast this cash flow projection out further into the future, taking all the way out to December of 17. So if you go to
the light, there's a light switch right behind you. It's on the wall that where Peter's sitting. No, it's right by the clerk's desk right here.
No, it's down by the clerk. She has it here.
Yeah, that desk, it's right there, so that we can see this a little better for everyone up on the screen.
There, that'll work a little better. So With the significant update to the cash flow projections, I had to go through and update the data and assumptions and everything so that you guys understand how I put it together. So what you have on the chart on page...
Is that
3,
visible to people in the audience or not? Can you see that okay or not really? I just want to make sure. What's that? Okay, you're right. I had to learn at one time, so I'll... Do you know? I was talking to...
There's hard copies on the table over here.
There you go. There should be one more that gets the dome light down a little bit more. I'll just yell.
There you go.
There you got it.
Oh, fantastic.
Good job.
Okay. We're ready to continue. We'll wait for Director Vanderpool.
Sorry about that.
Good to go. No, I appreciate it. Thank you. So anyways, as I was saying, cash flow projection, significant update. The green line up to July of 2016, and you can see the labeling there on the bottom x-axis, is actual month-end cash balances. And a couple things I'd like to point out was the steep decline that we all are aware of that happened last fall that led to a number of actions by management and a lot of the agencies and entities and participants, and they began prepaying. So you see that big spike there at the end of December 15. That was the first month that entities prepaid significantly, i.e., they paid their January premiums to SJVIA in December to help kind of stave off the cash flow issues. Now, because they prepaid, you'll see that little decline in January. That's just because of the timing, so you didn't have as much cash flow in there. The other thing I'd like to point out that's pretty significant in here is the downturn in June of 16. And basically, those entities that had been prepaying weren't able to prepay for whatever reason. So we went from approximately $2 million plus in prepayment premiums in December to just a little over $600,000 at the end of June. Now, I don't know exactly why, but I would imagine that it's an individual entity's budgetary constraint. Okay. So since then, you see a steep incline in the month of July from the starting low point in June 16 of 1.1 million back up to a little over 4 million there at the end of July 16. A couple of things happened. A few more entities returned to prepaying, and the County of Fresno went from being in arrears to 2 weeks in advance. So there was a significant transfer of money based on direction from this board and County of Fresno board to do that, and that's where we ended. That's where we end at this point with actual data. The lower line is my projection based on 24 months history of actual cash changes month over month. And that number has been approximately $253,000 month over month decrease in real cash.
And that's the status quo, right? In other words, if we did no changes, this is where we would be going.
Absolutely. That line assumes what's happened in the last 24 months is indicative of what's going to happen out to December 17. Okay? The upper line, the small piece that goes out to December 16th is the remainder of the 16 calendar renewal budget and rates. So there's no changes in there. There's a couple little dips. That's due to timing of ACA payments and a few things like that. From January 16th out to December 17th, I used the current draft budget that includes no reserve buildup and no loan payback at this point to project. So I basically just spread their 12-month budget out to 18 months. And I was able to do that because within the budget, they include headcount and rates by fiscal year. So I was able, even though it was a 16-17 budget, I was able to take the 17 data, extract it, and use it to project all the way out to December 17th. or December 17th, because traditionally, like last year, you guys didn't adjust rates mid-year. That's my assumption. The steep curve, the steep line at the bottom of December, the assumption is at this point that the MOU with the loan expires December 17th. So without change, that spike would occur. Okay?
Yep.
Questions at that point? Okay. That really wraps up my presentation on the cash flow. There's a lot of the data, some of the highlights and data contained within it you can look over. Some of it's information that we've already gone over previous board meetings. A few things are new as it's updated now out further.
Sorry, can you again state, maybe I just understand, the top diamond yellow colored?
Yes.
In December, between November and December, that drop off would occur why again?
It has to do with a one-time ACA payment that happens only, it happens, 80% is paid in January every year, and 20% is paid in November. And I understand that balance is going to decline and go away. There's only $600,024, I believe, budgeted in 16-17 to pay for it. I want to say it was, that's right? Oh. I want to say it was a little over $900,000 split between the 2 months for this calendar year.
We don't set aside to smooth such a dramatic decrease in a short period of time over the course of a year.
Okay. The way the budget is put together for the calendar or fiscal year is in totality.
Yeah.
Okay, it's just $100 million in premiums, $100 million going out. Because we're trying to predict timing issues with cash and low or high points, if there's known things that could have cause a spike, like the loan payback, I want to extract that from their budget and apply it in the month that it occurs, because those are known. I can't really effectively predict the timing of claims to do the same kind of thing with the claims expense. So I smooth that just on a 12-month average.
Just to play devil's advocate, if that line were lower, if we were close to insolvency and that dip occurred and pushed us into insolvency in December of 2017, how would you otherwise adjust in the course of a year for that kind of payment?
You have to build it into the budget and the premiums that you're charging to pay it back, which is why I pointed out the fact that the current draft budget doesn't include payback of that $2 million. And even though their budget doesn't include it, it's still set to expire, as I understand, December of 2017.
Any more devil's advocacy? Are you good?
All good.
Okay. Any further questions from board members?
Lawrence, I want to clarify one thing. This cash flow projection does not include an assumption of paying back the loan by the end of December 2017.
Based on the information I received from Gallagher, there isn't $2 million in premiums in there to pay the loan back.
Right.
So what I did was I didn't adjust their budget. I just added that one-time expense at the end. If I hadn't, obviously...
To your line. So the green line includes...
Green line, my line is based on the actual...
Just current.
Just the month-over-month changes. I added it to the yellow line because they're the experts. They've projected the claims experience, the premium.
Yeah, sure, go ahead.
I want to...
Just to add some context to this information, and we'll obviously be moving through other agenda items. We will be addressing, scenarios for loan repayment. The rate assumptions here are very vague because we need direction from your board as to what those 2017 rate increases are, which ultimately will influence the yellow line as well.
Okay. Thanks for that point.
Just to add to that, absolutely. If you guys take action at this meeting and there's another budget drafted with the assumptions in there, Gallagher has been willing to provide that information in the past. If I have it, I will update my assumptions and then point that update out on future presentations.
Okay. Great. All right, this is an action item. Is there any public comment related to the financial projections? Okay.
I move to receive the update.
I have a motion by Director Worthley.
Accept the
Yeah, to accept this report. Yeah. We have a second by Director Borges. All those in favor, please signify by saying aye.
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 All those opposed, motion passes. We're now going to move on to. What actually wasn't an action item. It was information. I'm sorry. I was looking at the next item, which is a request to file the Auditor Treasurer's fourth quarter 2015-2016 financial report.
What the other item? Sorry. Warren Seymour, County of Fresno, again. What you have before you is cash-based financial statements showing receipts and disbursements, like I said, on cash basis, unaudited, for the fiscal year ended June 30th, 2016. On the left-hand side, you have the current quarter, but since we're really looking at the big picture and the whole year, I'd really like to spend my time on the year-to-date numbers. You'll note total receipts was up 3% over budget. That had to do with timing of, I believe, like a 27th pay period for County of Fresno this year, which you'll note drove some of the increases down in some of the fixed costs, i.e. there was money in, the premium goes out kind of thing, so your dental and vision and some of your Anthem, your pulling and administrative retention costs were driven by that. You know, the big number on the page, unfortunately, is, you know, the claims disbursement. Budget, we missed our budget target by $11.3 million last year in claims. And, you know, that obviously is pretty significant. The net result of that was a decrease in real dollars of $7.8 million in cash from beginning of year to the end of the year. That's the number you'd see down there, line 16. We call it change in reserve, but really this is our cash position. And you see this showing up in my previous chart from our high point at the beginning of the year, you know, of 7 million, 8 million, whatever it was, and we trended all the way down to finishing the year at 1.1 million. Now, as I said, some of that has kind of reversed in you know, since June 30th. But we're still right there kind of on edge with cash. You know, it varies anywhere from, you know, the 4 millions, it still dips down lower than that, a couple million. One of the accounts went negative the other day. Not significantly. We had money in the other account to cover it. There was no bank charges or anything, but it just kind of is indicative of how kind of tenuous that cash position is on a day-to-day basis. Okay? Any questions about this before we move forward, this schedule? No? Okay. On the next chart, we have broken out the administration, wellness, and communication charges. Again, left-hand side information is the fourth quarter, April through June. The right-hand side is the year-to-date. You know, one of the things that you'll note is that, you know, you see some increases in personnel and auditor time and even council time. A lot of that's been driven by extra board meetings, the extra work, the analysis, the management of cash flow, management receipts and payments, a lot of dialogue and working back and forth. Management, both HR, Tulare, and Fresno, manage timing of payments and things like that so that we don't go negative cash. You'll also note that not a lot of wellness spending to date. That's a result of defunding that vendor as a stave-off measure last fall. As you recall, the decision was made to defund the wellness program to save the money.
As the SJVIA, we are not funding wellness, but as an individual county, I will say that Tulare County has stepped up and put general fund money towards our own wellness campaign.
Absolutely.
Okay.
Wasn't indicating that anybody.
No, I know. I'm just saying to the audience that it's not like we're not doing anything on wellness. In Tulare County, that's what we're doing.
Wellness is a very important part of this entity, and I believe that's why early on that was a line item they wanted broken out separately on this chart. Okay, and I agree completely. Seeing no questions.
I did have a question on that. You know, we that's okay. That was just timing. Then I was looking at the liability insurance, the liability bond, and that showed up, but that's year to date, so that just means we didn't pay anything for that in this quarter. So
actually, those are like one-time fees. You'll
just
see
a one-time fee,
one time,
annual.
and then
Okay.
you won't see that again. I think it may actually be in the first quarter.
Okay.
Moving on to this is basically a cash flow statement. Again, it's cash basis, unaudited. You see, we started, July with over $5 million in the bank, and at the end of the year, as I said, we ended with $1.1 million out there in June. And again, it's all driven by, that disbursements being larger than cash receipts. Any questions?
Any questions? No? Okay.
Motion to receive and file?
Is there any public comment regarding this financial report?
Agenda? Is that the agenda?
OC, are you coming forward? Yes. Okay. This is an action item. I mistakenly said the last one was, but it was
fine.
information. So
I
you're
just
okay.
wanted to ask a question on the wellness. There's money that employees are still paying into the wellness, and as you can see by the line item. So if we're paying into if we don't have a wellness program, what's being done with that money? If it's meant for wellness. I mean.
Staff, or go ahead, Mark.
Thank you.
Thank you.
For wellness is being used to pay claims.
Okay.
That was the logic behind ceasing the program, but those revenues are going towards expenses, which you've touched upon and we'll cover on the next few items as well.
Okay. All right. Any further comments? Sure. Go ahead.
John Adams, Fresno County. I just wanted to ask a question. You may have covered this, but under the communications, what is that? That's almost $500,000 if you look on the total under wellness. It's under that column on the right-hand major column, year column.
When I look at the communications line item, it actually shows zero, but it's the wellness that has the $500,000.
Okay, so where did that's money that's been spent, or that's
it
money
went to pay claims.
to pay wellness claims?
No.
Just
Medical
claims
claims.
in general.
Oh,
Medical
okay,
claims.
so you shifted wellness funds to claims.
To
so that
pay
kind of
for-
answers OC's
OC's question. All right.
Thank you.
Thank
I would
you.
like to also add that we are paying through claims wellness activities such as the mammogram screenings, the biometric screenings. So we are still doing and have continued to do, even though we didn't do the very contract and the large challenge, we're doing other wellness types of and preventative measures related to wellness, but they are charged back through the claims process.
Okay. Thank you very much. I have a motion by Director Worthley to approve the filing of this report. I have a second by Director Borges. All those in favor, please signify by saying aye.
Aye.
All those opposed? This was an action item. Motion passes unanimously. We're now going to move on to item number 10, which is a request to receive and file the consultant's SJVIA executive claims summary through June of 2016. This is an information item.
So I think we're starting to kind of now narrow in on really the heart of the meeting today, and it's been touched upon in past agenda items or the ones that preceded this one, and I apologize for the font size. It's
not much bigger on hard copy. There are hard copies, I believe, on the table for the audience, if that's helpful.
At least the lighting helps, so you can kind of see it.
It helps
right?
on the screen, but it hurts on the hard copy. It's probably with the
Okay.
lights. So the first page of this illustration, it just shows the revenue against the expenses, and so we have a year-to-date look from a plan year, January 16 through June 16, of a total premium collected of $27,539 and change. And we look at the premium versus the cost associated with that, and we've got a variance of $803,000 or 103%. And there's the bar chart shows it by month. The green line is budgeted premium, and obviously we've got some cost fluctuation from month to month. But then the summary position of this document just states that we've paid out more than we've collected. And so that is, again, one of the things that is driving the difficult renewal that this board's facing. The next page, I think I can just, PPO. Second page is the same format, same information, January through June, but focusing on the PPO plans. And for those plans, we've got a premium from January through June of this year of $27,700,000, and we have a variance of $313,000. So we've spent $313,000 more year to date than we've collected in premium for the PPO. And you can see it by month on the chart. Again, the green line budgeted premium and the blue bar being plan cost by month. The final page is the culmination of the HMO and the PPO combined. So for all plans, HMO and PPO plans, premium to date is through June $55,310,000. We've exceeded that in claims or by 1.1 million or 2.1%. That's the bottom right figure up on the screen here. So, be happy to entertain any questions. I know, just for your board's information, we will be going into a little more detail and tying this information to the projected rate increases in subsequent agenda items.
Anybody have any questions?
I just want to make a comment, and that was what I was referring to when I made my generic comments to the folks who came forward, was that this is the facts upon which we have to deal as we look going forward. And the fact that we paid out 102% of our claims receipts, and that includes after we took and made those changes where you talked about paying into wellness, and we used that to pay claims. We took those dollars and applied it to these claims, and even with that, we still ended up paying out 102% of the budget and receipts. Those are the facts under which we have to operate, and those are going to be the basis as we go forward looking at increases, because it all falls back on the users of the insurance. And that's why I said that's what's good about this. It's not like we can blame what's happening nationwide, statewide. We hold the keys here in our own hands by the people who are participating in these plans, and that's the benefit. Or in that case, I mean, if we can beat the norm, if we can be 80% or 90% of projections, then that reflects itself in the next year's premium payments. But if we exceed it, we have to deal with that. And that's the situation we now deal with today.
Any other comments? One comment that I would make too is just, I know that this is every year is different, but just comparing HMO to PPO, the increase and you look at the total numbers of members, I think it's just important that we all realize that it's not a consistent split in every member entity that's a part of the SJVIA. For example, Tulare County's membership in the PPO plan is 82% of our employees. On the HMO side, it's 18%.
Probably a little even less than that because you've got some Kaiser
HMO and Kaiser.
Correct.
But then in Fresno County, you guys have you have 80% of all HMO enrollment. And so I think that's important context that we have to remember, is that every entity has makes up a different composition of each plan. And trend? Is it just a one-time occurrence with costs being significantly higher in one over the other? We have to be mindful of all these things as we make decisions going forward. So I just wanted to make that point as well. All right, this was an information item. We will now move on to item number 11, which is a request to approve HMO and self-insured PPO health plan renewal rate increases for plan year 2017. And real quick, just clarification from council. This item, we are not able to approve this item today. Is that correct? Because we do not have a supermajority of each board. Is that correct?
That is correct, Chairman.
Okay. So this is going to be heard today, but there will be no action taken. We can, give general direction, but not a formal action by this board. Okay. So item number 11.
Chairman of Board and Council, if appropriate, number 11 and number 14 closely relate to one another, and since neither one of them are something we can actually take action on today, I would ask, could we open both of those as part of this discussion, because they do link together.
I think so. I think that would be appropriate.
I'm going to make a few introductory comments, and then I understand Mark and Gallagher will get into some of the detail of what you have in front of you. Between now and the last meeting, there's been a lot of work being done, but I want to start on just the foundation. If you take a look at the first page of the agenda item, the beginning reserve position of the SJVIA has been a lot of discussion over the last several years. What does that really mean? How is it calculated? And bottom line, we want to make sure that it was the actual cash position of the SJVIA at a point in time, and that had been looked at, audited, and confirmed. And so the SJVI staff did that, had it also reviewed by the SJVIA Auditor Treasurer as of July 31st, 2016, to determine once expenses for that month are paid and we've accounted for everything, what would that number be? And that number in front of you is $903,802. And so as we go through the numbers today, that is foundational to our starting position that will be spoken to. I will just say this, that does not include the loan repayment or the reserve restoration that we'll be talking about. Those are separated out, and you'll see why as we go through the item. The second issue that was of importance and is foundational to the rates is the assumed trend for the medical and the prescription costs. In the past, Gallagher has given the assumed trend, and that there was a lot of questions as to how that number was determined. Your board directed staff that we not only look at Gallagher's number, but we have our individual consultants provide numbers, and Gallagher, in addition to that, has some other numbers. So I'll ask Mark, if you would, to bring up that attachment and comment on the trend and the number that we've come up with.
Yeah, so the attachment and was included in the board material. Probably better to look at the copy in front of you, unless it's visible for you on the screen. What we did is we looked at multiple data points to achieve what we will apply to the renewal this year for trend, and we looked at Gallagher's own Gallagher Analytic trend position. That's the first line item listed in the matrix on the chart there. We took several of the carriers. We also used the input of the County of Fresno, the County of Tullare's independent consultants. The methodology that was used was giving a 50% weighting to Gallagher's trend position, which was 5.8% for medical and 14% for prescription, and weighting that with the remainder within the survey. We achieved a blended trend result listed at the bottom of the page, and that will be illustrated in the rate projections that we'll walk you through, of 6.2% for medical and 11.5% for RX. And just to put that into context and maybe to tie into Board Member Worthley's comments, if the chart that we had just gone through, if the final number was 100%, so if we had spent right on the nose the amount of money that we had budgeted for in expense, and that carried forward, what trend says is that for the following year, if you had the identical claims experience, that you've got unit cost inflation. So the same medical claim this year, in theory, would cost 6.2% next year. For prescription, the same prescription drug claim, not the copayment amount that the member pays, but the expense to the SJVIA, if it was $100 this year, it would be $111.50 next year. And so this is a critical component when we look at projecting renewal costs. So this is one of the cost drivers that builds to the renewal. And I'll let Paul touched upon already the fact of we've got a reserve position. We also have a loan repayment. So those are kind of the key components that really drive the renewal rating action that's before the board today.
I just want to, before we move on, I just want to, any questions about the trend or how that number was come up with? No. Okay. So moving on in the item number 3 in the agenda item itself, talked about.
Paul, I guess I do have a question. Excuse me, I'm sorry to interrupt you.
You missed your chance.
No, go ahead. Well, okay, so we're using this, and I have no reason to question it. I guess my question is, what is the basis for these increased costs? So, there was a point, I remember a couple years ago where it was the Affordable Care Act, and there was a tax that was going to be charged against everyone. And so that was something that had to be included in your premium payments, obviously. What's the driver here? Is it something about the Affordable Care Act? Is it just general inflation? What is it that is driving this kind of an increased cost?
Great question. So it has to do with the contracted rates that Anthem, for example, has in place with the providers, or that the pharmacy benefit manager has in place with the pharmacies that are dispensing the medication. So those negotiations are ongoing. A board meeting or two back, there was some concern if Kauai Delta was going to renew that contract. Those contract negotiations start out where the provider says, I want a whole lot more money, and the carrier says, we don't want to give you that much. And they come to some middle ground, and that's the backdrop behind when we refer to medical and RX trend. We also look at the actual claims utilization. Is the utilization increased versus what it was? But specific to kind of maybe a unit cost trend is a fuller definition of the trend that we just talked through.
Thank you. Mark, do you want to touch on increased utilization and cost shifts from Medicare? Because those are
Yeah, to my colleague's point, that there are other cost drivers. That's one of the main. Increased utilization and cost shift from Medicare has an impact on how those providers are reimbursed through Medicare versus the amount of money that they'll then want to collect from private insurance. And so it gets into that bigger sphere of our system and how it's functioning today or not functioning today.
So, and what you're saying therein is that, in a sense, we are helping to subsidize Medi-Cal claim costs because they're so low that for the providers to stay in business, they have to find revenue from some other source, and so they look to us and private pay people.
Yeah, us being all private payers. Yeah.
Mm-hmm. Mark, could you comment on the impact of specialty medication with the pharmacy number? Because that is another big increase, and certainly that's a piece of it.
So if you notice, the prescription drug trend number that we're using is much higher than the medical. And so some of the cost drivers, in addition to the ones that we've just stated, also include specialty medication. And so that is the highest cost increasing component within pharmacy is specialty medication. And so those are claims that are incurred by individuals with chronic conditions. Those aren't lifestyle related claims. Those aren't people that, man, if they would have done the Walkie Works challenge, they wouldn't have this condition. And so while those conditions are more challenging to mitigate within the population, they have a direct cost tied to them. And so there's a very small number of individuals within the SJVIA pool that are taking very costly medications. And so that subset for specialty pharmacy itself is increasing at a much faster rate. If we were to strip that out and we were to look at just retail traditional pharmacy, we would be able to use a much lower trend. We cannot strip that out. Those are life-saving medications for individuals. Those are things that are in all health plans. It's just it has that impact, and it's not specific to the SJVIA, but it affects all private pay plans.
I have a question then. On the reinsurance, does it only cover medical procedures and not cover the pharmaceuticals?
So the stop-loss policy for the PPO plan covers medical and prescription, which includes specialty. That's the definition within the contract. So all of those claims are eligible for stop-loss reimbursement under the PPO. Under the HMO, we have a pooling point with Anthem. That pooling point and the definition of that policy, if you will, excludes pharmacy claims. You say, well, why would we want to include it on one and not on the other? We were able to achieve through the marketing efforts and looking at different outlets for pharmacy benefits to carve out the pharmacy claims from Anthem, and they are now with U.S. Script, right? But for Anthem to include pharmacy claims in the definition of that contract under the HMO, they require that those claims be adjudicated through Anthem. And so we've looked at what would the premium increases be for that specific line item for the Anthem HMO pooling to include pharmacy without regard for any discount erosion that might occur by paying under a less advantageous reimbursement rate. And the cost benefit was not measurable, or it wasn't achievable. So if it would cost, $600,000 more to cover those claims, we anticipated that, we would pay, $800,000 more in premium for those. And so that was the rationale and some of the background behind why one contract covers it and one doesn't.
So then, to make very clear in my mind, when it comes to the very type of medications you've talked about, the pharmaceutical costs that are very expensive, on the HMO side, those are being paid out of general claims.
Yeah, they're being paid out of general claims under both sides, but we have a specific deductible. So when said individual's claims for the calendar year, exceeds $450,000 for the PPO plan for that one individual, right, then the stop-loss policy kicks in and pays those claims.
Right.
Under the HMO,
on the HMO, there's nothing like that.
There's a $400,000 pooling point, and we're covering other stuff in this, but this is I think good. Under the HMO, you've got kind of three different types of claims, if we will. We have capitated claims, so we have a fixed payment for those claims. So there's really no risk to the SJVIA for capitated claims. We have non-capitated claims, and then we have pharmacy claims. So the pooling point under the HMO covers for a specific individual once their claim amounts for everything other than pharmacy exceed $400,000, then the medical claims would be reimbursed under that policy. Pharmacy claims would not. Because it is a known expense, these aren't necessarily catastrophic claims. An insurance company, if they know what the risk is, they're not going to put the premium charge associated with that risk at an amount less than what they feel they're going to pay out. And so that's why the definition of insurance is to protect against the catastrophic and unpredictable. And because this is predictable, the benefit of insurance under the HMO, coupled with the fact that we would erode the discounts that we've negotiated through U.S. Script if we were to carve the pharmacy benefits back in, it doesn't quantify, it doesn't pencil. If I cause any other board members headaches, I'm sorry.
Don't get bored just started. He's just waiting to play devil's advocate, so just be careful.
As long as you're angel's advocate, Pete, we're okay. So.
All right, so if there's no further questions on that, number 3 was the claims experience period. In the past, there was discussion as to how we come up with that period. Traditionally, we've used 12 months of claims experience to come up with the rates. Last year, we used an 18-month period, and there was a question as to was that less conservative or more conservative? How did that affect the rates? And our recommendation and your board's direction was we will do a survey of 12, 18, and 24 months of claims experience, and we will take the most conservative of the 3 to ensure that we're not manipulating the numbers or doing something different to make it look better. Rather, this is the true conservative number. And in doing that, 12 months, which I think you can see from the claims report that was just shown, was the most conservative number. And so that was the other direction your board gave as we go forward.
In terms of being most conservative in reflecting costs, like actual costs that are being incurred by the plan in projecting what the next year is going to look like. I just want to make that point
If you
very
go back
clear.
too far, you're masking the trend. The
Exactly,
trend
and
is going
that's
up, and
the
you've
point
been-
I'm making.
you're hiding it.
And the population in the most recent 12 months is more reflective moving forward than it was in 18 or 36 months. So higher degree of certainty associated with it.
So setting that foundation, there's other items that I want to show you as we go through this, but I think this is a good jumping off point, Mark, then for us to bring up the actual renewal presentation. As Mark goes through this, I think it's just important to note this is the rates outside of loan repayment or reserve restoration. So we'll talk about that as soon as we finish this, and then we'll talk about plan design as well.
Thank you, Paul. So the attachment on the screen, again, hard copies, if this is more difficult to read. We look at, again, 12 months of claims activity, first with the PPO plan, and that 12 months of claim activity, if you could turn in your hard copy to page 2, we turn that into a projection. And so we look at total claims paid for that 12-month period. We deduct out any credits back into the plan. Those credits are for claims that have exceeded the pooling point under the PPO, so it claims excess of that $450 deductible. We touched upon trend, so we're using 6.2% for medical, 11.5% for pharmacy, so for a blended trend of 11.37%. And so if we didn't have a loan repayment and we didn't have a reserve that we need to rebuild, and if the cost had come in to the penny of what we had projected, the impact of trend on the renewal is listed here. Now, it's listed as a higher number in this calculation because we have to trend claims for a greater period than 12 months. So in other words, we have claims utilization data that we're taking through June, yet we're trying to project costs through the end of 2017. And so when we convert that into a trend for that greater period of time, the 6.2% trend is equated to a 9.44%, pharmacy at a 17.74%, again for that blended 11.37%. We have a pooling deductible here, and I'll defer to John if you want to comment on our pooling deductible, what that refers to.
Well,
I could carry the microphone to you.
No.
It's connected.
Good morning, John McHugh with Gallagher. You will see on the second line is we take out claims that have exceeded, in this instance, $450,000. What our methodology does is, let's say, for example, you had a claimant of $500,000. What we will do is we will take out the entire $500,000 and then trend it forward. The reason we do that is if you just took out what was over the pooling amount, you'd still have $450,000 left in your experience. If you project that forward, it's still going to be over the $450,000. Your liability is capped over at the $450,000, so we don't want to add something in that you would not have to pay for in the future. So we would take out the entire claim, apply the trend factor, and then add the claim back in at the $450,000 level. I think, yes.
If you're excluding those high value payouts, but we've been seeing that there have been extensive high value payouts in a pattern over time. So how does that comport with the smoothing effect that you've talked about if you're not somehow incorporating them into the projections, not just on top as a cost?
No, we are including those claimants. So as you can see from the pooling deductible is 1.35, which equates to there were 3 large claimants this year. So we have added back in. What we do not want to add back in your liability is capped at $450,000. If we keep, let's say you had one claimant at 450. If we trend that forward, we would expect that claim to be, let's say, 500,000. You're not liable for 500. You're only liable for the 450.
Okay.
Okay.
Got it.
So
Got it.
Okay.
Yeah.
Thank you. Stand by. I might need you again. So we look at current enrollment, and we lag that by 2 months because we have claims lag. So if a claim's incurred today, it's not going to be submitted and reimbursed till a period in the future. And so when we look at claims experience from July of 15 through June of 16, we tie that to the enrollment of May of 15 through April of 16. So we look at 12 months of enrollment, but we look at a 12-month data set 2 months further back because a claim incurred in April would be paid in theory 2 months later. And so that the enrollment and the experience correlate more closely rolling forward. We then develop a average paid claim for the period, and then the projected paid claim for the upcoming period is the tan line listed there of $898. That's a PEPM rate. So that is without regard for dependent coverage. We convert that in a subsequent page. And then we look at what your current enrollment is today. So for all PPO plans within the SJVIA, the current June enrollment shows 5,752 employees, again, without regard for how many dependent lives are covered, but we'll call those subscriber lives. And then so we take the projected paid claims rate times the current enrollment. We come up with a monthly projected amount as well as an annual projected amount. The bottom two items are where we start to get into claims reserve. The green bar represents 8.5% of reserve for medical and 4% for pharmacy. Pharmacy claims are incurred and paid at a quicker rate, so we need less money in reserves to pay those claims. If the SJVIA plan were to cease to exist, no revenue would come in, but bills and claims would come in. And so the minimum reserve is based on a lag study that Gallagher performed. That's the amount in which Gallagher feels should be held in reserves. Your board, at a recent board meeting, acted to suggest that we build to a 14% medical reserve and a 5% RX reserve. So you've got some more margin in there, and so we won't be as impacted by some of the cash flow issues that we've discussed at this meeting and so forth. So those two numbers for the PPO equate to $4.4 million of expense or of IBNR that Gallagher says you should have if you were to terminate the plan. That's what we anticipate that expense or that liability to be. Based on board's direction, $7.1 million.
And Mark, not to interrupt, I think it's really important. I think when we look at it and it says minimum required reserve, we have all these talks about reserve. You can get that terminology confused. So it's not like in the bank reserve that we have money that's going to basically pay our claims each month. You're talking about IBNR, and I think that's important to use. So maybe just scratch the word reserve there and just put
incurred
IBNR.
but not reported, IBNR,
Exactly.
incurred but not reported claims, reserve, is what we're
Say
referring
it
to.
quietly each
Yeah,
time,
I'll kind of
please.
cough when I say it for you, Pete. Yeah, so you're exactly right. And so that is the PPO, and then those numbers onto the next page in the illustration with a very interesting font size that is intended to put a lot of information on one page. We have fixed costs associated with the PPO plan. Those fixed costs are covered in the description for item number 11. They're also going to come before the board in subsequent board items as well. But with fixed cost, excuse me as I try to locate in this illustration, we are anticipating claims plus fixed cost without regard for that brown or that green IBNR of total projected cost with fixed of $66,612,000. So if you look at the very bottom, the third figure up, that's what we're saying, our projected claims cost plus our fixed cost. We compare that to what's the current rates. What are we collecting today, and how much does that generate? And if that generates $55,600,000, the difference between those two numbers is the needed rate action, a 19.67% rate action, again, without regard for loan repay and without regard for IBNR adjustments. And I know we'll touch upon those through the course of this discussion. If you just bear with me as we click through, and I'll get to a summary page here as quickly as I can, I promise. Same format on the next page, again, but with HMO claims. And what we see on the HMO side is then correlated into a projections page onto page 5. Again, same format. We've got claims exceeding the pooling point, and that's listed as a credit. We've got net paid claims. We're using the same trend figures. We're using the same data period as for the PPO, and so the trend explanation applies in the same way here, except for capitation. We actually have a fixed cost associated with capitation, and so that item's actually addressed on the following page as a fixed cost, but from a claim standpoint, and it actually works up to the projected paid claims cost under capitation is the actual amount. That's not a projected amount, but we've worked backwards from what Anthem says 2017 capitation rate of $301 needs to be. So bottom two lines there, minimum IBNR required, again at the 8.5% and 4%. We don't need a IBNR for capitation because there's no run-out liability for those claims. But for the HMO based on enrollment, $2.8 million. Projected required IBNR based on your board's appetite at the higher percentage amounts equates to $4.5 million. If you flip to the following page, page 6, and again focusing just on the bottom line numbers, the projected cost of the HMO with fixed costs, $62.6 million. Current HMO plan funding, $54.8. Rate action required, 14.25%. And I promised you a summary page that reflects those numbers, and that's what's displayed there on page 7.
Now, Mark, has any of this, does any of this take into account individual plan design? So if you're enrolled in the zero deductible PPO versus the $3,000 deductible PPO, because I know that we've talked as a board about seeing the numbers as to what the actual renewal rates, what the cost would be if it was, pay for what you receive. So if you're a zero deductible plan member, your cost went up to, let's say, 20% this year. Yeah. You're going to pay that 20% renewal. But if you're a $3,000 deductible plan member and your cost stayed the same, you're going to have a same renewal this year, just so that would be presented to the board for
sure. And it's listed under blending options in the agenda item. Okay. But to speak to that specific one, that would be blending option number 2. And the challenge with looking at specific plan designs and applying separate rate actions for those plan designs, we run into a few challenges. One, we don't have the law of large numbers, if you will, to apply to each plan design. So as a whole, the SJVIA has predictability because of its size, because of its membership size. Yeah. But if we were to silo that out and look at certain plan designs, it would not have the same level of credibility or predictability to it. So that's one challenge that we would have in looking at an individual rate action by plan design. A second challenge would be, so for various member entities, Tulare, Fresno, and others, more than one plan design is offered. And if we were to take a rate action, say on the 3,000 plan, for whatever reason there were large claims up to that pooling point and it skewed the experience, and we used that
3,000 deductible plans, PPO experience to project a rate action for that plan, we could end up with a PPO 3,000 plan that costs more, or rather costs less than the zero deductible plan. And if that were to happen, well, we know everyone's going to migrate. Man, if I can get the zero deductible plan for cheaper than I can the 3,000 deductible plan at open enrollment, I'm going to switch.
But doesn't that end up costing the employee more for making that switch if they are a high user of medical services? Because they have to pay the higher deductible each time they go. So you're actually, when you go to the doctor, you have to pay more each time you're there.
So the plans have a different unit cost associated with them today. The rates today for a 3,000 deductible are less than that of a 250 deductible. And so that's kind of a built-in incentive determinator for an employee as far as plan selection.
Okay.
But a $400,000 claim, typically that's, again, unpredictable, catastrophic. That claim is no more or less likely to occur if an individual had a zero deductible or had a $3,000 deductible. So the methodology, it's a valid question on the surface, but when we start to really look at it in detail, the sum of the parts aren't able to be bifurcated and siloed out and have any credence to what the underwriting output would be for each one.
So, and I know we've also had the conversation and questions have been made in the past about, is Fresno County going to offer both the HMO option and Kaiser at the same time? Are they going to only offer one and then maybe charge a fee for switching, or however that's going to work out? In Tulare County, what if an HMO plan isn't even offered in Tulare County? Have those questions been factored in at all into what we're seeing here?
Yes, I'll take the second one of that question and just provide a response. So in Tulare County, for example, if the HMO plan were to no longer be offered, based on the fact that you have a significantly higher PPO population and that the HMO population that the County of Tulare has today versus the SJVI as a whole is inconsequential to the rate action. So if Tulare elected to not offer an HMO plan anymore, we would still say that the rates for the HMO plan would need to go up, if on a standalone basis, 14.25%. Again, notwithstanding revenue and rate action for loan repayment and IBNR rebuild.
So, and given that, if Tulare County were not to offer an HMO option for the blending, the overall blending of rates, we would be a standalone. So I don't see how we would be how the PPO would be required to be blended with the HMO, or having them renewed separately. I want to make sure that we're seeing those numbers in front of us too.
Yeah. So if you were to renew with PPO only, with your experience blended with the SJVIA still, the impact to the SJVIA would be those 300 members, employees that are on HMO would have to shift. You might be asking about, if you look at the agenda item referring to one of the other blending scenarios. If you're referring to number 4, which would be where Tulare, their claims cost and your rate buildup would be based exclusively on the County of Tulare's claims
and share
experience.
The fixed costs.
And fixed cost only. That's a different scenario than the one that I just provided an answer for. And if that's the one that you're referring to, I'll defer to Paul and Ron, and then I can provide follow-up feedback.
Yeah, and maybe we'll have to wait till we get there when you get through to that point in your presentation.
Yeah.
But so I'll just stop asking you. You can go ahead and continue, and we'll just wait until we get to that point.
Before you move on,
yes,
this is my simplistic way of asking: are the trend rates the same for both the HMO and the PPOs?
The trend rates that are applied in the calculation are the same. The illustration, I won't take the time of the board to pull it back up, but if you look at the matrix on the trend illustration, certain contracts have a different inflationary rate associated with them. The HMO plan this year, for example, capitation is a significant amount of the total cost for the HMO. Well, the capitation rate for the HMO is going up about a percentage point. Because that's a fixed cost, then the trend numbers that we're looking at here don't apply to that cost item. But they can go up at different rates. Is a simplistic
what I'm sort of
answer.
struggling with, and I think the answer is probably in all these numbers. Maybe you can point out some of the specifics or the
Okay.
key ones. But as we looked back earlier, we saw that the actual claims cost this last 12 months was 2% or more on the HMO and basically 1% on the PPO. So they had a higher claims cost than, in other words, they lost more money on the premiums paid than did the PPO.
Yes.
Right?
Yes.
Okay. And if the trend costs are the same, then why is it that we're looking at a 19.65% increase on the PPO and only a 14.25% increase on the HMO?
Yeah, I'll John's chomping.
As a point of clarification on the claim report, the executive summary that was shown where I think you saw the 2% differential, that data was for January through June. It does not take into account July through December of the previous year, where the claims for the PPO outpaced the HMO. So for the last 6 months, that statement would be correct.
I thought it was year to date.
It's calendar year to date. Yeah. So.
Okay. All right. So that was that's the big difference. Then you're saying.
Yeah, I think that, and the cost components that make up the HMO are similar in some ways, but different in others than those of the PPO, and so capitation is a significant amount of the HMO expense, and that specific line item is only increasing at a percentage point. And
so looking at a 40,000-foot elevation,
okay.
One of the issues that we've been dealing with in Tulare County for a number of years is that the HMO costs have been increasing dramatically more than the PPO costs, and we've been dealing with that in terms of blended rates and semi-blended rates. So you're saying at this point, looking back over a 12-month time period, it's reversed. The PPO costs have exceeded by far the HMO cost increases.
Based on how the current rates are structured. So I think
that sounds like weasel words to me. Are the costs of providing PPO services higher as a percentage than the HMO costs?
So if the same claims were to occur under an HMO model versus under the PPO model, is the PPO a more efficient delivery of those benefits than the HMO? All being equal, is that what
I'm talking about on a cost basis?
Okay.
We've had this has been a big issue for both counties these last few years. We've seen HMO costs go up dramatically, more so than the PPO cost, and yet we've had these sort of blended or semi-blended rates to for whatever reason. And so this time around, we're showing that the PPO cost, if we were just a standalone, we'd be saying they're going to go up 19.67%, based upon what we just talked about in terms of claims costs, trend rates, and if we apply the same cost of benefits and claims rate to the HMO, it's only going to be going up 14%. So that would reflect that PPOs have gone up a greater percentage than have HMO costs.
Yeah, that's what those numbers reflect for this year.
Because that to me is a critical factor in our conversations.
Yeah.
Because I think we felt for a long time there had been this trend that seemed to be going the opposite direction and had been for some time, and that was a concern to us about the continuation of having blended rates where it became obvious that HMOs were running way ahead of the PPOs. And if the PPO is now running ahead of the HMO, then it gives us more, it gives me as a director more confidence and continuing on with a blended or semi-blended rate. But that I wanted to make that very clear because I'm looking at the initial numbers and it didn't add up to me. But you've explained it to me as to how it works. So
would it be helpful to get a breakdown year by year on the differentials in favor of one against the other to satisfy the argument that blending
that would be of interest
works.
to me, and but the bigger concern had been the trend, because the trend had been the first couple of years HMOs helped to subsidize somewhat the PPOs, and then there was this pretty good long stretch here where it was just the opposite.
And I have that. I can tell you those numbers right now, and we've talked about them at previous meetings. So for the years that it was an individual, we rated individually separately for Tulare.
HMO for PPO separate.
Yeah. In For 2011 was the first time that we did this. It was a for each entity for Tulare County. It was a 12% PPO increase and a less than 1% increase for Fresno County for HMO. For the PPO. And then on the HMO side, Fresno County had an 8.1% increase on the HMO side, and it was not applicable in Tulare County. And then in 2012, the PPO increase for Fresno County was 7.5%. In Tulare, it was a 2%. On the increase for the HMO for Fresno County, it was a negative 1.6%, and in Tulare, it was non-applicable. And then when we started blending them was in 2013. The rate increase combined, individually for the HMO was 6%. For the PPO was 4.6%, for an overall blended renewal rate of 5.4%. In 2014, the PPO increase was 0.1%, but the HMO increase was a 13.6%, for an overall blending of 8.7%. In 2015, the PPO increase was a 3.3%, and the HMO increase was a 9.8%, for an overall blending increase of 7.3%. In 2016, the PPO increase was 0.9%, and the HMO increase was 16.9%, for an overall blended renewal of 10%. So that's a little bit of history. You can see one subsidized the other for the first couple of years, and then every year since it's been PPO subsidizing the HMO.
Up until what we're looking at today.
Yeah, I think that
up until today.
The challenge in looking at an HMO rate action separate from a PPO rate action versus the blending is that it's the same risk pool. And so the same logic that would prevail around not looking at rating a $3,000 deductible on a freestanding basis versus a zero deductible PPO on a freestanding basis. We're trying to manage the risk of all members at open enrollment. For the majority of the membership within the SJVIA, there's an option of Anthem HMO, several PPO plans, as well as Kaiser HMO. We can't control the Kaiser component of the risk pool because it's a fully insured contract with Kaiser. But we can control those other two components. And so an argument for blending would be it promotes the stability. So we would look at the actuarial value of those plan designs, and if the HMO needs to be $20 more on paper, in other words, if we had the exact same claims experience under the HMO as we did under the zero deductible PPO, the expense should be, $20 different or 3% different. That's a way to promote stability across all plans, but certainly, the board has the ability to look at separate increases. But that would be an argument for blending two together.
If I can just add a quick comment to that, just to clarify, I think that one of the difficult pieces of this is the SJVI started pooling in 2012. That's the first time that risk was actually shared between Fresno and Tulare. When we started that, we took whatever was left in our, quote, reserve. Fresno County had about $5 million. Tulare County had about $2 million. That was what built what was the beginning reserve of the SJVI in 2012. What becomes difficult at this point, and you'll see what has been discussed as we go forward, is whose money was that reserve? Well, what plan donated to that reserve? And as we go forward, you can see how difficult it has kind of gone back and forth. It's a very good question to have. Where is it really happening? Let's see the numbers so we can see. That's, I think, what you're going, Supervisor Vanderpool, is there needs to be a mechanism to hold plans and entities accountable, which we'll speak to a little bit later in the agenda, but the difficulty of unwinding that reserve has been one of the challenges of the process.
Sure. Go ahead. What has bringing all these other entities into our group? How has that affected did we check these people prior to letting them into our
into the risk pool?
Right, into the risk pool.
It's a great question.
Did anybody check to see what their claim history was before they came in?
Sure.
That affected where we are now.
Great question. And so we have underwriting guidelines in place, which your board's approved. We have an underwriting committee that is
the managers of the SJVIA. And so we haven't added any member entities for some time now, but you do have several other entities. It's grown significantly in member entity size from 2 members, right, Fresno and Tulare, to 25 members. And we have looked at the claims experience of the newer member entities, the added member entities, the non-founding member entities, and that claims experience, while it's a much smaller number of the total, so if Fresno and Tulare make up 75% of the pool, the remainder, call it 25%, make up a smaller number, the underlying claims experience for those member entities as a whole has been as favorable or more favorable than Tulare and Fresno have been. So if the question is, have the new guys messed it up for us? No, when we look at it, they haven't. And if they could have messed it up, for you, it would have been to a much smaller degree because they're a much smaller percentage of the overall pool. But in fact, when we look at non-founding member entity experience as a whole, they have performed at or better than what the pool has. So that is not a causation, a very reasonable question. And to the extent that we can, when an entity has actual claims experience, we certainly use that to factor into how those rates are developed for those member entities. When it's not available, we use demographic information. What's the average age, geographic location, where they're located, that influences pricing, as well as rate history. What are their current rates today? What would their renewal be if they didn't? And we use a much more complex than I'm explaining for you, formula to develop those rates. Okay.
Okay, any other questions or comments from board members? Okay, you can continue on with your presentation.
Thank you. Paul, where would you like to go from here on the agenda item?
I think we talked a little bit about the baseline of the rates. If you return to the actual agenda item where there's, my version actually doesn't have a page number on it, but it's the second page where it says there are 2 components of the rates that need to be added on top of the renewal. We need to be discussing this portion. So we talked about the reserve, and I'll call it the restoration of the reserve and how we go about that. This needs to be built on top of the rates that have been discussed, and the reason it's not put in there is because this is where we need to make a decision here at this board level, although it won't be made today. The other component of the rates that need to be added is the repayment of the loans. Now, just to restate where we're at with the loans, County of Fresno has loaned $2 million to the SJVIA. County of Tulare, there is on the item on the agenda today official approval of the document that would allow for the Tulare County to loan when needed. And so based on the cash flow projections that we saw from Lawrence, there was the expectation that we'd rather plan for that and hope it's not needed, but we're planning for it. And so if that is needed, that's $4 million to repay. What we asked Gallagher, and I'll have Mark speak to this, is what would be the effect of, first, if you talk about the loan repayment, your board directed, give us options if we were to renegotiate with Fresno and Tulare to repay it over 1, 2, 3, all the way up to 5 years. What would that do to the impact? And we'll talk about that in a moment. And then what would it take to rebuild the reserve, not in 1 year, but over multiple years? And so, Mark, if you could refer to this attachment. And
sure. So the attachment 3, I think as it's labeled in the board material, the top box or matrix speaks to the loan repayment. And so we've got 2 items on the left. We've got a $2 million and a $4 million loan repayment. We've got $2 million out, and I think there's speculation that we will need to draw on the loan that Tulare has made available to the SJVIA prior to the end of this current plan year. And so, Paul, if you'd like, I can focus on the $4 million loan repay. So what this says is, in addition to whatever board action is taken on the rate renewal,
components that would need to be added on top of that from a percentage increase standpoint would be a loan repayment. And we've modeled it out up to 5 years. So if it's a $4 million loan repayment and the board's appetite is to pay that back next year, we would need to load those renewal rates by 3.09%. And if you were to elect to pay that loan back over a greater period of time, the effects are listed there. So a 5-year loan repayment of a $4 million loan would increase the rates in the upcoming year by 0.62%. Now, we'd have to look at that next year and see how we performed on repaying that loan based on the revenue that's collected and the claims that are out.
So Mark, real quick though, based on this first scenario, and I'm glad this isn't, you didn't make up numbers, but for us to realistically, if we were to abide by the contract that's currently entered into to have this line of credit available with Fresno County and Tulare County, we're supposed to be repaying those loans if drawn upon by December 2017. We're talking about an 18.96% blended renewal rate plus an additional 11%. So our health insurance rates for our employees are going to be going up 30% if we were to select that option.
Option number one is a 3.9% inflation.
Yeah, but plus the rebuilding reserve.
Yeah, if you're taking both of those.
Yeah,
so if your scenario is $4 million loan in 1 year plus the $10.7 million. Now, you call it a reserve. I call it IBNR.
Yeah, but I'm just saying.
So adding those two components together would be 11% on top of those renewal rates.
Yeah, sure.
Before we get way into this conversation, I remember when we had the independent auditor come in and talk about the fact we don't know whether last year was an anomaly or not. We certainly know it was a much higher claim year than we've had historically. And the comment I remember him saying was that you never know when you're going to have a year like this, but I can guarantee you are going to have a year like this.
Yeah.
And they're going to come along periodically. But it doesn't mean that we necessarily have to have another year like this next year. It could be back more to what we've seen historically be our claims rates. I would hope our colleagues from Fresno County, and that includes us if we have to make the other $2 million loan, would look to extending that loan with the idea of paying it back if we don't have another one of these crazy years of high claims. And same way with the reserves. I think we do need to build reserves, but when we look at the amount of an increase we're looking at now for our employees, it's a very substantial increase. To pile more on top of that, certainly it's justified in the sense that money has been loaned and reserves do need to be rebuilt, and I don't think anybody, or increased, I don't think anybody disagrees with those concepts. I mean, the fact they have to be dealt with.
Correct.
They don't necessarily have to be dealt with this coming year.
That's
and
correct.
I would personally like to see us look at going through this next year to see how we are faring and hopefully find our claims employees drop substantially to where they have been more historically, in which case there could be the reserves right there to pay back this debt and to build reserves for the coming year. But to add it on right now, to me, the chairman said that's crazy. I agree with him. To say we're going to increase rates 30% when even the rates we're talking about increases are very, very substantial increases, I can't see us doing that. I just, in good conscience, and again, we haven't put out the $2 million that Fresno put out already, but we will probably put out our $2 million in the coming year. But I just can't see that we would pay ourselves back this coming year unless we find ourselves in a situation when we're here next year and we find our claims have dropped, and now we see we've got a built-in reserve, if you will, because we've built in for claims that don't materialize, and we may have a lot of extra money. That would be a nice thing to happen. Yeah. So I just, that's one director speaking, but I hope I maybe speak for others as well, because I just think
you do.
I just think it's outrageous.
So if I could maybe
Brian wanted to make a comment real quick, so I'll just save you some breath in case you have to respond to him.
Supervisor Worley, I would concur with you, and just speaking with Supervisor Borges here, while we are not obviously the majority of Fresno County, I would concur with you wholeheartedly. While it is the intent to pay it back in a year, I do believe Fresno County would be willing to extend that, knowing that from what we heard today, what we continuously hear at our board meeting, each and every meeting, how it is a hardship to the employees, while we will have a rate increase again this upcoming year, to pile on top, I think would just add insult to injury and be even more detrimental to all of our employees. So I believe Fresno County would be willing to extend that for an extended period of time to help ease the burden on the SJVIA cash flow, as well as the burden on each of our two entity employees.
Does that extend also to the idea of not trying to expand our reserves?
Yes, I believe we would do both.
Yeah, in the context I was going to add to the reserve comes into play in the event that the plan were to be terminated. So if the goal is to continue the SJVI moving forward, then a step towards rebuilding the reserves need to be made. It doesn't necessarily need to be a entire step to get to the $10.7 million figure in the upcoming year. And we will continue to monitor and revisit this. So, we hope this is an anomaly in claims experience. If it is, then we will have sufficient surpluses to make even more progress than a 3-year or 5-year, rebuild or loan repayment.
And I think it's appropriate just to make the comment, whether I believe it or not. I know that there have been conversations amongst amongst any member entity. There's got to be something better out there than this. And if in case that does come into fruition, we have to be mindful of that because we may have entities exiting it. We may be presented with a better option for our employees in Tulare County next year. Fresno County may be in a similar situation. They may say, hey, there's a better option for our employees next year. We've got to be mindful and have a very clear exit path for an entity if they do want to get out. So we may have to bring back another agenda item at our next meeting or at a meeting in the very near future as to what an exit would look like, because I don't think our original JPA agreement really spells that out, and how reserves would be distributed should an entity exit. Because I think all of us, Fresno County, and I rarely try to speak for anybody else, or Tulare County, we all want what's best for our employees and what's going to be the best option. And if all of a sudden some white knight comes riding in and says, hey, we can take care of you guys and we're going to offer you rate decreases for the next 5 years, great, sign me up.
Get it in writing.
Yeah, well, I know we have to get it in writing, but we have to have that ability already written up into the SJVIA. And also remember how these loans are going to be repaid, how the reserves are going to be distributed or built up over time. There's a lot of things that we're going to have to figure out. And I think this discussion is going to go on for an awful long time, and we're not going to be able to actually take an action because we lack the quorum to do so. But I think that it's appropriate that we have this discussion because we're going to have it. It needs to be said. We may have to rehash it again. I hope not, because we've already hashed it out here. But just a few comments that I wanted to make.
I'd like to make a kind of I'm always kind of a historic, contextual guy, but I remember.
It's because you're old.
That's because I'm old. I've been around a long time. But I remember when I first came on the Tulare County Board, they had the opportunity to enter into a 3-year contract to hold healthcare rates exactly. They did not change for 3 years.
Yeah.
What happened was that during the meantime, the market was doing this, and it went up dramatically. So at the end of 3 years, we were back in the marketplace. And the increase was unbelievable to our employees. They didn't remember the 3 years of savings they had. What they remembered was the increase that hit them. And my reason for saying that is we have been way below, we have saved our employees over the years significant premium payments because we've been below the market for a number of years. All of a sudden this year, because of a combination of projected increases and because of claims rates, we see we're going to probably be above the market. But we do need to take a little longer view on it. And if you look at how we have saved people money over the several years that we've been involved in this authority, to destroy it because of 1 year and what may be an anomaly in terms of claims and so forth, I think we have to be careful. It's like, where do you jump? And Mr. Vanderpool made the comment, well, what if somebody came along and offered you a sweetheart deal? Well, it's not unknown in the insurance business to offer you a sweetheart deal to this year to make you make the move, and then suddenly you find you've got big increases the following year. And then what do you do? So I just think it's good to take a long view of this thing. And, I mean, this is very, very painful for employees because of the rate increases we're talking about. Don't forget, a lot of us have been driven by the claims, of the employees that have driven a big part of this. But over the years, we have saved our employees a lot of money. And there's the potential to continue doing that into the future, I believe. But I just bring that up to kind of put it in a contextual basis, because it's easy to focus on the right here and now, and it is painful. I mean, it's not. I don't like what we're going to end up having to do. The writing on the wall is not pretty.
I drew the short straw, so that's why I get to talk today. So, yeah.
Well,
it's not fun news to deliver; it's reality as well.
To parallel with that, I think another aspect of this can be found in the plans that are being offered. And I'm curious as to, when does an individual entity, such as Fresno County, when do we have the ability to change the plans that are being offered?
Yeah, so I think discussions are underway at the county level for both Fresno and Tulare to look at plan options to help mitigate those cost increases. So is it to not offer a zero deductible plan, but instead offer a 500 deductible plan in its place? And so those discussions I know are underway specifically to both Tulare and Fresno. Those changes and outcomes wouldn't necessarily have to come back before this board. This board approves rates and a menu of SJVIA plan design options. And so long as you're ordering off the menu, then it's kind of an individual member entity decision as far as which plans they would want to add or which ones they would want to no
that's
longer
my point.
offer.
I think the menu needs a change.
Okay, we can certainly.
Yeah. So when
look
does
at
that happen? Yeah. What is
I
the
can
deal?
answer that. Both Fresno and Tulare County independently. At Fresno, we've got the Health Benefits Advisory Council, so that's labor's at the table with us. That's being discussed as we speak. So one of the difficulties in going through this process is not knowing what is the final number has made it difficult for them and us to make that decision. However, they've been presented and are looking at other alternatives. And they are an advisory body, but we'd like certainly to go through this process and be in unison with what our employees want. Right now, that includes coming forward with some alternative plan designs, some different options. At County Fresno right now, if you compare our plans to the ACA, they have colors, bronze, silver, gold, platinum. We're offering platinum plans, and we need to offer more options to our employees that are not just the highest plans. And so that's part of the consideration. So you'll see that the County Fresno Board and labor is involved in that process. But what we vote on, I know it won't be today, but at our next meeting, will be the foundational rate, and then the plan design will either go up or down from that foundational rate depending on how we change plans.
Okay, I understand that, because, again, being one of the newer members and not having the historic Supervisor Worley, I was surprised to learn that the plans that Fresno offer is dramatically different than what the County of Tulare offers. And I would think that we would all have the exact same plans, and you just pick. And so it was interesting to me to learn that that's not the case, and that may be why one entity, their increases are less than another entity, because the plans aren't the same. And to me, it's surprising that it's not the same for all 24 entities, that we all picked and choose the same thing. So, again, I don't know how that came about or what the reason is. I'm sure there's a good reason, but it's pretty hard to make decisions when your plans are different than your neighbor's plans, and I'm sure that's got to affect the rate somehow.
Yeah, to clarify, all member entities have access to the same plan designs. Different entities have selected different plans. When the SJVIA was formed, we kind of said, well, Tulare, what plans do you guys offer today? We'll make those SJVIA plans. We'll put those on the menu. We did the same for the County of Fresno. And so there are multiple plan designs available. As far as how those rates are impacted, If it's a PPO plan, it's received the PPO rate increase, or if it was a blend increase for that year. So we haven't increased plan designs by entities. So whether you offered plan PPO plan A, B, and C, and city of...
So the way, if I understand you, you're saying, let's, for an example, okay, hypothetically, let's say that the SJVIA offers 8 plans, and PPO, H&O, and everything in between. The County of Fresno chooses to offer 6 of those plans, and the County of Tulare chooses to offer 4 of those plans. Is that what my understanding now of what's happening, but all the plans are the same?
The plan designs are the same. The unit costs, the rates are different. In that scenario, yes, you're correct. I would just add that the $250 deductible for Fresno doesn't cost the same as the $250 deductible, I'll say, for Tulare in that example, but both receive the same rate increase because there's different demographics. So when Fresno and Tulare came together, that was the jumping off point for rate pooling and experience blending. And so the jumping off point was different for each. And so, a uniform rate increase has been applied for Tulare and Fresno and all entities, but their starting points are different. Virtually all 25 entities have a different rate for that, say, $250 deductible plan, but under our rating model, all entities would receive the same percentage increase, but the dollar amounts would obviously be different.
Well, then, for me personally, that would go back to Director Ennis's point earlier. It's hard to understand as a board member how those additional entities are impacting our founding organization, because maybe they're the increase, maybe they're the decrease. Now, you just told us it has a negligible impact to us, yet if they're pooled at a different rate with different plans and different things, or higher utilization less, for me, it's counterintuitive to see that that's not having an impact on our 2 organizations.
Yeah, so this board, the SJVI up to this point has not implemented a shared risk rating model. Yeah. So the PPO increase has been applied uniformly across all member entities, again, with different underlying rates, but same percentage rate impacts.
There are variables that are insurmountable. I mean, just from the standpoint of for Tulare County, only a very small portion of our employees even have the option of going to Kaiser.
Yes.
We don't have. You probably have more competition to provide services where we have less. So Cahuilla Delta, I believe, has been a higher priced contract. That's been an issue, I think, here in Tulare County. I mean, so we don't control what the hospitals negotiate with the insurance carrier. I mean, they come to an agreement, and that's part of the issue. You can't really make it all the same because we don't live in the same area in terms of providing services.
That's what
those differences.
That's what makes it hard to compare.
But I also think it's very important to make the point too that within our original underwriting guidelines, we did have a tool that would allow us to. I hate to use the word penalize, but it is penalize an entity.
We say adjust. It sounds better.
Adjust. Okay, you say tomato, I say tomato. But so we have the ability that if an entity is really performing badly, that we can add a surcharge to their renewal rates. And in many cases, I'm sure that even with the penalty or the surcharge, we're still going to be a better, more competitive option than anything else they're going to get out there. But my question to you is, have we used that tool? If so, how much?
Have we needed to?
Yeah, so the tool hasn't been, I'll say, deployed, or it hasn't been factored into any past renewal rate actions. It's on the agenda item listed under experience modification factor.
Okay.
If you want to direct your attention to that, it's the third page, rather. Third page, towards the bottom, it says experience modification factor. I can try to find it here on the screen as well.
Oh, yeah.
Yeah, there we go. I got it.
For the audience.
The staff report, so third page.
So it's attachment 4?
Yeah, attachment 4. The verbiage I was going to just touch on first, and then we can jump to that if you'd like. Just to provide the
Is this the first year we've done this? Because I don't recall.
Yeah, this is the first year that we brought it to the board.
Okay.
Gallagher's looked at it historically. The underwriting guidelines have a complexity in that there's a 3-year initial period, which their entry period and their two subsequent renewals for new member entities are not subject to the underwriting guidelines as it relates to the experience modification factor because of the growth that we've had, and now those entities, I'll say, are maturing.
Yeah.
It becomes relevant in the standpoint of the opportunity to levy it is there. From a, is it going to move the meter, from a 19% PPO increase to a trend increase? No. And again, because it's such a small percentage of the overall pool, that those member entities that if that risk charge or risk adjustment, rather, because it sounds better, were applied, it doesn't, I think it creates around a $500,000 of additional premium or revenue, and we're talking about $140 million
But still, I think that it makes an entity pay for the benefits they're receiving. I mean, if you've got unhealthy people and you're not encouraging or making changes, you got to pay for that,
Sure.
Even if it is a minor increase to the overall rating. My thought. But.
Yeah, and so one thought might be to look at expanding that experience modification factor, so it's not just a penalty, but it's so that it's a charge or a credit. So if you fall in better than risk pool, that's something that's been asked to explore. The challenge that we have when we look at these specific member entities, they're very small in size, and so one person could spike that claims pool. Is it non-reoccurring? But we're talking about such, when we dissect it down to the member levels, premium volume, it just, I think, merits further consideration beyond. I agree on the surface and philosophically, it's clear if you're using more, you got to pay a little bit more, right?
I'm going to go back to what I said before. I mean, we're talking about substantial increases this year. To pile anything on top of anybody, if it doesn't really, because we're saying we have both above and below. We've got some people who are helping the system, some are hurting the system, but overall they're not hurting. The overall group is not hurting the system. I think it bears looking at into the future. But personally, I think this year would not be the year to implement it, just because of what we're going to have to do to people in general. And I do see on the list that County of Fresno is on your list there.
And the naughty list, is that?
The naughty list.
Yeah, no.
Yeah, but that's the first page. What about the second and the third page?
Yeah, depending on which page you look at. So I'll.
Yeah.
Well, we don't
what
have
about
to
page
go
2
there,
and 3?
but I think if what I'm saying is kind of the consensus of the group, I think it's something for us to look at, and I think going forward, it would probably be a good thing for us to sort of take seriously. But not in a year when you're talking about increasing people's premiums the level that we are right now. I just think that's an additional burden that we don't need to put on people right now.
So, and again, I'll just remind everyone, kind of bringing it all back together, that there is no action that can be taken today because we're short a quorum necessary to do so. We're going to be having this discussion, I'm sure, again, hopefully not in as much repeating what we've done today, but rather covering new stuff that comes forward at that time. But is there any more significant that you want to get covered in your presentation before we move on to the next item that we can take action on?
We have one more item you can't take action on, which is item number 14.
Yeah, and I know it's included.
Yeah, if the board's comfortable.
Yeah, sure. We said we were just going to kind of blend the whole discussion, and I think we've covered other items as well in this conversation. Go ahead.
Pardon me. So even though we cannot vote today, if I can recap what I think I'm hearing, consensus, a non-voting consensus. For both repayment of the loan and the rebuilding of the reserve, I think I'm hearing consensus that the feelings as of today would be leaning towards the 5-year period of time in the development of the rates. Is that
yeah.
Okay?
Well, for an extended period, we don't know.
Or deferring.
Whether
I would rather not see us building it into even a percentage of increase, but rather deferring it for a year because of the increase.
Yeah. Let's see what it's like next year.
Yeah, I think we're in agreement. We want to defer the whole thing for 1 year.
Okay. And just so you know, we've had conversations with Lease County Fresno Council about our ability to do that, so we've already started that process. And then the experience modification factor consensus is tabling for the next year, but looking at both doing it positive and negative for the following year and bringing that back to your board.
Right. Yeah. Yes.
Okay. All right, so does that conclude your number 11 and 14 presentation?
I'll hit on 14 really briefly.
Okay.
If you'd
Real brief.
like, you can read through it in further detail. Kaiser
one
is
thing
also...
quick, just to clarify, Mr. President, you're intending to take public comment on both items after you've heard them both?
Yeah, we're finishing up on this one.
Okay. And then you'll take the comment on both, right?
Okay.
Because we combined the presentation just for non-voting sake.
Got it. Number 14 has to do with the Kaiser renewal. Kaiser is offering a 8.34% renewal rate increase. Again, different rates at each entity for Kaiser, but an 8.34% for all entities, with the exception of County of Fresno. Both Kaiser and Gallagher, I think, have some consensus around the concerns with an 8.34% increase for Fresno. Kaiser feels that based on kind of demographics and utilization, they would suggest a higher County of Fresno rate increase. From a Gallagher and from an SJVIA perspective, we would suggest a higher than 8.34% rate increase as well. Why would we want a higher rate for Kaiser at the County of Fresno? We feel that if Kaiser were to receive a significant price advantage within the environment at the County of Fresno, and again, geographically, there's a lot more access to Kaiser at the County of Fresno, so that's where our concern's most paramount, is we wouldn't want to create a spiraling effect where if people vote with their wallet and select Kaiser, that it has a detrimental impact to the SJVIA rates, both at Fresno as well as the SJVIA as a whole. So
and that's a conversation that Fresno County has to have on their own versus what...
Well, these are SJVIA rates, so it still has to be an SJVIA conversation, but we would recommend that an 8.34% rate from Kaiser be adopted with the exception of County of Fresno, and that the County of Fresno Kaiser renewal increase should reflect an outcome that creates the same price difference that exists today between Kaiser and Anthem, as so not to disrupt and have a huge migration, and then the Anthem plan becomes unsustainable. The pricing difference today on an employee-only basis is around $33. And so we can't recommend a Kaiser rate action until we know what the Anthem rate action is, and that's how those two are tied. So
Is it also an option of Fresno to freeze the new membership into that category? And we keep the existing and freeze any new members?
Unfortunately, a stipulation in the Kaiser renewal offer does not allow for a freeze of enrollment.
But we can do that by way of the rates then?
Yeah, so that would stabilize it in that way rather than prohibit it.
Okay. All right. Thank you very much. This was an action item. Even though there can be no decision made today about it, is there any public comment at this time? Go ahead and please come forward and say your name for the record.
Sure. Tania Johnson, SEIU Local 521. I just want to say that we appreciate the board is considering all options to try to bring back the lowest rate renewal you can with this year in the anomaly. We understand that health insurance is a shared cost, and we can fundamentally agree that we can't punish workers for using their health care because you want to have a productive and healthy workforce. And I think that's at the core mission of even the counties, because productive workers, right? Healthy workers are productive workers. But I just wanted to say that it's not enough to just focus on the claims to drive the cost of health care. We get it, but it's really not that simplistic. The entities you represent are the workforce that are dedicated themselves to be public servants. And what I hear from workers all the time is, why do I have to stand in line for the same benefits that I'm helping our communities with? We're all, and I know that you all have been good stewards of public taxpayer money, and we want you to continue to do that. So it sounds to me that there are some things we can look at doing differently. We're more than willing to give you some written recommendations, but here are some things that we just thought about. We also know that, I heard them say about the Kaiser surcharge, that people are basically making choices on their wallet. That's true. We have workers who are choosing lower benefit plans than what they need for their care because of the cost of the plans. So what we know is that employer contributions, they also drive enrollment and their plan choices. If we have caps on those contributions, we are shifting the burden of the increase all to workers, and I don't think that that's fair. Also, look at intervention. What are the things that are being done to impact the rates so what you're not doing is continuously just dumping more money into it? Some of the ways that you can mitigate high claims are adjusting plan design to make sure that the services that are being utilized the most are more affordable so workers can get those. There's some things with lifestyle drugs. Should those be the same cost as things that people need for maintenance or prevention? Also, just design a wellness program, and I know a decision was made to get rid of the VRA and to go to a localized wellness program for the vendors. But really, how can you hone in on with your entities where you're seeing high claims and high usage, using the current wellness dollars to bring programs that address those issues? There are programs out there for diabetes, I want to say maintenance or, taking care of diabetes control, where you can actually use wellness dollars to fund that because you have a high population that has diabetes. I know you're doing walking works, and that's great, but how can we get more workers engaged in that? Because we live in the valley where obesity is number one. So I just would like for us to figure out how to partner together to not just look at cost, but the things that are driving the cost and how we can create programs like chronic disease management to address those things. Those are things that your healthcare vendors should be focused on as well, because they have the ability to provide those services. So we would like to work with you on that to make sure that county public workers have access to affordable quality care. Thank you for your time.
Thank you. Next, please state your name and address.
Hello, my name is Ocio Segura. I'm with Fresno County. I was going to talk about the surcharge, but since you already said it, so a couple of things. We always talk about people leaving Kaiser and causing problems with the HMO, but you guys know that we have an opt-out provision where employees can get out, right? There's about over 400 people in that plan that used to be HMO members. We also have the HDPPO, which has about 400 plus members that came out of the HMO plan. So when you look at all the whole picture, don't just say, well, it's Kaiser's fault. No. It's the county's fault for allowing all that stuff to happen. Back when that opt-out provision came, SJIU was adamant, and we said, no, it's going to hurt the plan. They said, whatever, just let it happen. Now you're seeing a little bit of all that stuff. That's 800 members that could come back into the HMO. I remember back when the SJVIA was formed, it was supposed to be the intention of the SJVIA to bring whatever plans we have to get us the best rate and let the members decide. Now we're saying, well, Kaiser has to be more because they're going to come in at less. The thing has to be, if Kaiser wants to come in at 8%, that's their business. We shouldn't be able to dictate, it's got to be higher because we're trying to protect the HMO. I mean, what are we protecting the HMO? Are they doing a lot for us? I don't think so. We need to look at all those options and then come back and say, okay, this is what we need to do. When you have 800 lives that are doing whatever they want, that's not very positive for the HMO part. On the prescription side, our consultant in Fresno County, we had a discussion, they were saying utilization. They said, well, last year, a lot of people utilized Harboni. I understand it's a cure, but we found out that there's another drug less expensive that does the same exact thing, and a lot of other entities. We're paying $100,000 for Harboni. Some other entities are paying $60,000. Who is checking on that stuff? Does anybody look at it and say, hey, why are we paying $100,000 and somebody else is paying $60,000? Those are the things we need to look at. We're just saying, okay, we'll just charge whatever. The members will pay for it. We'll say it's utilization side. We'll just, write it off and put it on the employee. No. We need to have somebody looking at the stuff and say, hey, you're going to charge me $100,000. I'm going to look around and see if there's something cheaper. Thank you.
Thank you. Next.
John Adams, Fresno County. Just wanted to, there were some comments from your board regarding claims and other things and problems with controlling spikes and those type of things. I just want to remind your board that our consultant addressed those issues. She had a very limited amount of time, so she briefly addressed them. But I just want to let you know that there are means to address those situations. I also wanted to stump for communication with the Better Valley Health, and that when you're looking at claims, which seems to be a major problem, we've asked for information and not gotten the information. You need to know, as OC and other speakers have referred to, you need to know what claims are causing the problems and how to address those. Is it somebody with cancer? Is it somebody that has diabetes? What is the exact issue? I am in concurrence with OC, some of his comments, that I don't think these things are being looked at. We would be willing to look at that and work with you. There seems to be, with the board, that, well, we're addressing many things. We're on a board of supervisors, we're on this board, we're on other things. We don't have the time to work with these. Don't seem to have the staff, and it doesn't seem like Gallagher's working with these issues. If all the entities that are working with this don't have the time to work with it, I'm telling you, we will work with you and try to determine these things. But we need the information, and we need some transparency. You need to work with us. I am also wanted to stump for what OC said about the Kaiser. If the whole thing on doing your different medical providers, whether it's Anthem or PPO, HMO or Kaiser, is whether they are competitive or not with each other. Whether you go with Aetna or one of these other ones, that's the whole idea of this board, to try and figure out what's going to be working out. If Kaiser is offering a better program, then maybe, I personally don't like Kaiser, but if that's something that you need to move to offer that, then maybe that's where you need to go. Thank you.
Thank you, John. Is there any other public comment at this time? Okay, seeing now, I'm going to close the public comment period. This is not able to be voted on at this time. We will move on to item number 12, which is a request to approve the Anthem Blue Cross as the SJVIA Health Plan Administrator from December 19, 2016 through December 31st, 2017.
Okay, before the board today is the approval of the Anthem fixed cost components of the plans. I can pull it up on the screen, but I think just in the interest of time, if you, let me just grab it real quick. Okay, so for the upcoming year, Anthem, as the administrator for the HMO, or PPO rather, in the health plan on the HMO side, we talked about what the fixed costs, what their function was in the prior exhibits. What we're referring now to is the actual unit cost for those fixed cost components. First, specific to the PPO plan, Anthem is currently charging $29.41. They're asking for a renewal rate of $32.53. That's a $3.12 increase. A percentage basis on those $2 is 10.61%. On the HMO side,
Mark, what was last year's?
Do you
remember? On the fixed cost side, what Anthem offered?
Dan, do you remember? We'll look at it. It should be in the renewal. We'll have someone look at that. We can look back to that if that's okay. $29.41. That's the current year, right?
this year. What was
There
it?
was a 0%
What was the
increase
last year. Do we know? Yeah. Yeah. So it was
So
actually
went
a
down
decrease.
last year.
Yeah.
So we had a decrease last year, and then they're making it up with a 10% increase this year.
Yeah.
Okay.
Yeah. On the HMO side, it consists of not just administration, but it also for Anthem, it's the pooling on the HMO as well as the capitation, which is for the claims component. So it's a larger dollar figure. It represents a larger percentage of the overall plan cost for the HMO. Anthem is requesting that the increase from $366.04 per employee per month increase to $374.04. It's a 2.185% increase or $8 increase. Additionally, Anthem has offered a not to exceed clause of 6% on the ASO charges associated with that for the upcoming renewal. I mentioned that in light of I think we're on the front end of embarking on a selection process, a vetting, if you will, looking at Anthem, looking at Aetna, and possibly looking at other vendors next year. So while I think the rates are competitive this year, I think we will be able to negotiate those again next year and have some leverage points. We don't look at other vendors every year, but when we do, it tends to have a positive effect. The increases are very minor in relation to the overall rate buildup. If Anthem were to offer a rate pass on both, it would not change, the renewal percentage increases that your board's looking at.
Okay. Any questions? Okay. Any public comment? Okay. Seeing none, the chair will entertain a motion.
Move approval, Mr. Chairman.
I have a motion by Director Worthley.
Second.
Second by Director Pacheco. All those in favor, please signify by saying aye.
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 All those opposed? Motion passes. All right, we're now going to move on to item number 13, which is a request to approve the amendment to the Health Now Administrative Services Agreement.
So item number 13 refers to the Blue Shield plan. Currently it exists only for the city of Tulare today, so they have a separate fixed cost administrative fee. Their claims are still part of the SJVIA pool, but that specific contract is with Health Now Administrative Services and utilizes the Blue Shield of California PPO network, whereas the Anthem network is the network for the remainder of the SJVIA for PPO plans.
Motion approved.
Second.
Any questions, comments, any public comment? All right. We have a motion by Director Worthley, a second by Director Pacheco. All those in favor, please signify by saying aye.
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 All those opposed? Motion passes. We're now going to move on to item number 15, which is a request to authorize the execution of a loan agreement between SJVIA and County of Tulare for a loan of up to $2 million.
This is the loan agreement we've already discussed. It's modeled after the County of Fresno agreement. Approval today, with your direction, we'll be coming back to adjust it based on more years, but this will at least get it in place with the County of Tulare's approval of the agreement.
Okay. Any questions or comments? All right, this is an action item. Is there any public comment? Okay, seeing none, Chair will entertain a motion.
Second.
We have a motion by Director Borges, a second by Director Worthley. All those in favor, please signify by saying aye.
Aye.
Aye. All those opposed? Motion passes. All right, before we adjourn, because we did not have a quorum today, we have to meet again to take up the two renewal items. Anybody want to open their count? What is our drop dead date that we have to have the renewal in place by and voted upon? 120 days prior to the plan year beginning, correct?
That's the issue, and I think we're going to have to be flexible with some of our entities because that's August 31st. So
Okay.
We have some entities that I know, some of whom are here, have open enrollment pending, so we were hoping within the next 5 to 10 days we can, including Tulare County, get that meeting scheduled. So we're looking at facilities now.
Okay.
We'll ask you and your staff to be assertive in letting us know if you've got a conflict, if it's something that can move or not.
Okay.
We've already got some of that availability today, but if you can let us know as soon as possible, we'll try to schedule that as soon as possible.
Okay.
Are we expecting this to be a meeting where telephonic presences will be allowed?
That is an option. It may be difficult to do that because of the nature of the discussion, but it's an option. That was the next question. Where do you want to host it? Do you want to do it telephonically between the two counties? That's an option.
I think it'd be easier for Tulare, but probably easier for Fresno as well if we don't have to ask the other to come to the other's jurisdiction. It just takes a while. Maybe telephonic might be good.
You're a Fresno guy. We're used to driving around.
You're such an urbanite.
Oh man, got to get time off the dairy, Vanderpool.
We're open to your direction. So
okay. I think that we have to make sure that we have a significant staff presence between both Tulare, Fresno County. Fresno County has a consultant. We have a consultant. We have Gallagher Benefit Services as the SJVIA consultant. We've got public comments that are going to need to be made. I would rather personally see us find a date that works, a date and time. It may not be the traditional 9 a.m. in Fresno County or Tulare County. I just think we have to be a little bit flexible because this is absolutely, this is why we exist, the vote that's going to be taking place. So it's an important one.
Would you like to have Fresno host the next one, but then have the next
Yeah,
one?
that's what we've always done.
It makes
is
it easier
rotate.
for the Fresno guys to show
So
up.
we'll move the November meeting.
or we can meet at the Starbucks in Fowler or something like that in between.
There's plenty of seats for public comment.
Okay. All right, well, so we will work on getting that meeting scheduled, and we will now move on to Supervisor Borges' favorite item on the agenda. Item 16, that's adjournment. He's been biting at the bit to get out of here this whole time. Thank you for attending, and stay tuned. We will be setting in our next meeting very soon. This meeting is adjourned.
Be good, Sailor.
Be good. Have a great weekend.
See you at the festival?
The Greek festival?
Yeah.
I'm not Greek.
Ryan's coming?
I'm not Greek.
Yeah. Not Greek.
I don't eat gyros or whatever that other stuff you guys have.